Deputy Minister of Health, Dr. Joe Pahla, Ms. Steve Litseke, Co-Chairperson of SANAC, Dr. Gwen Ramaphosa, the Chairperson of the SANAC Trust, the CEO of SANAC, Dr. Farid Abdullah, Professor Sheila Tlo, the UNAIDS Regional Director, our MEC of Health, this province, and the acting mayor of this town, leaders of civil society, and the sex worker sector. Ladies and gentlemen, it is a real joy and a pleasure to have been invited to be at the launch of this plan. Now, Deputy Minister Bokgopane Zulu, you've been talking about prepaid and pay-as-you-go. Now, as you know, with pay-as-you-go, sometimes people who do pay-as-you-go, they run out of airtime. Now, sometimes you have a dropped call as you are discussing something very important, and then you call them back if you are on contract, and you say, "What happened?" They say, "No, I ran out of airtime." Now, how does running out of airtime work with sex work?
That's running out of condoms.
She says that's running out of condoms. It could also be running out of steam. It is fitting that today we should be launching this National Sex Worker Sector Plan, this plan that has been so beautifully crafted and drafted and presented. It is a real plan. It's almost like when we launched the National Development Plan. This is the plan. It is good and fitting that we should launch it on Human Rights Month, for this is the month when our people in their struggle against oppression and exploitation, a struggle for human rights, got their struggle into top gear. And it is good that we are launching this plan on this day and in this month. We are launching this plan because this plan is about human rights. It is about the rights of ordinary people, ordinary South African. It is also about affirming the equal worth of every person. Sex workers, every South African, all of us included. This is about affirming our rights as well. It is about affirming the rights of all South Africans to life, to dignity, to health, regardless of their occupation and regardless of their sexual orientation and regardless of their circumstances. This is a plan about public health. It is also about how we South Africans are able to demonstrate our care for all other South Africans. It is also a plan of how we express our solidarity. We launched this plan knowing our national effort is moving ahead in terms of arresting new HIV infections, that this effort that we have embarked upon will not succeed if sex workers are disempowered. It will not succeed if sex workers are ignored. It will not succeed if sex workers are neglected, if they are forgotten, disregarded, marginalized, and stigmatized. In launching this plan, we call on all sex workers to recognize the enormous power that they have in their hands in terms of helping our nation in making AIDS a thing of the past. This is your plan. This is a plan you must use. You have been involved in crafting this plan. So use this plan to help our nation to fight the scourge of HIV/AIDS. We cannot reclaim the morality of society by excluding the most vulnerable amongst us. Whatever views individuals might have about sex work, whatever beliefs that we might have about sex works, whatever the statutes that are on our law books might say about the legality of sex work, we cannot deny the humanity and the inalienable rights of people who engage in sex work. Sex work is essentially work as well. Sex work is a trade. It is work that is also recognized by our Constitution. Like anyone else, sex workers have dreams. They have customs, they have beliefs, they have a faith, they are human. They are just like all of us. As one of them was saying during the poetry, they also have blood flowing through their bodies, just like you and me. They too have mothers. They also have fathers, by the way. They have families, they have children, and they have all these people who love them and appreciate them as well. They have the right to be treated with dignity, the right to their bodily integrity, and they also have the right to say no. It has been almost 2 years since I became the chairperson of the South African National AIDS Council. In that time, I've had the privilege of working with a number of government departments, many people in government, a number of civil servants. I've had the privilege of working with many civil society leaders and members and their organizations, people who have been at the forefront of the struggle against HIV, AIDS, and TB. And as I have interacted with them, I've come across some of the most committed people who are involved in the struggle against HIV and AIDS. They have impressed me immensely with their knowledge and deep knowledge and their total commitment in this struggle. I have come to appreciate how stigma continues to impede our country's response to these diseases. I've also come to learn that many men are still refusing to come forward to be tested and have treatment offered to them. I've heard how the financial challenges that a number of civil society organizations are facing impede their work, and they are therefore not able to mobilize the masses of our people because these civil society organizations live amongst our people. They are connected to the majority of people in the villages, in the townships, and all over else. I have come to hear that they face serious difficulties at a financial level, but they still remain committed to the cause. I have listened very carefully as the Minister of Health has spoken about how we can put 90% of people living with HIV on treatment, and how we need to do so much more to tackle TB, particularly in the mines and in correctional services. In all this time, one of the issues that has been brought to my attention that has struck me as particularly perplexing, contradictory, and surprising is the matter of how one department of government, the Department of Health, has this great capacity to supply and distribute to sex workers condoms after condoms to protect them from HIV, to protect them from pregnancy, and to protect them from contracting sexually transmitted infections. And it is not uncommon at the same time to come across one other department of government acting in pursuit of law enforcement, going around arresting sex workers and confiscating the condoms that were distributed by one department. This has surprised me. And as South Africans, we must pause and think about this. The one department gives condoms, the other department takes condoms. And we need, in a very sober manner, to sit down and discuss precisely this dichotomy, because it is a contradiction in terms. And I would appeal that we should do so without much emotion. We should do so in a very sober manner and ask ourselves in dialogue and discussion, how can it be that two government departments are acting against one another around the lives of sex workers? So this is homework for all of us as South African. We have been unable to respond to the legal and social, as well as health and the welfare, in terms of the dimensions that affect sex workers in a very comprehensive manner. And we need to grasp the nettle and deal with this matter. We see this plan that we're launching today as a step that is going to enable us to deal with this matter in a very procedural manner. We have heard today that the rate of HIV among sex workers is among the highest we have seen in any community in our country. Frankly speaking, the rate of HIV among sex workers is quite alarming. But whilst it is alarming, what it does say to all of us that we have a responsibility to do something about it. With HIV prevalence rates 3 times to 4 times higher than amongst female sex workers than in women in this general population, in the general population of their age group, we must realize that we are faced with a serious challenge that we cannot ignore. This is a very worrying situation. This is why SANAC, the body that combines a number of stakeholders in our country, has prioritized the prevention and treatment of HIV among sex workers. The development of an appropriate response does actually require reliable data. We are grateful to the United States Center of Disease Control and the University of California in San Francisco for conducting the first detailed study of HIV prevalence amongst female sex workers in South Africa. I was particularly pleased when I was introduced to our friends from the United States who come from the University of California, and we would like to applaud them for being amongst us and for having done this fantastic piece of work. The work that they have done has helped us to plan a national program that will eventually reach all sex workers in our country. I would like to thank the Technical Working Group, the Department of Health and Social Development and Justice, and various stakeholders, in particular the sex worker community, for working together to develop this national plan. This plan is informed by fundamental principles. It is informed by the principle that women and men who are involved in sex work must not be denied health services, they must not be denied information or advice. It is also informed by the principle that sex workers should not have to suffer and also die from diseases that are preventable, that are also treatable, and that affect all of us. It is informed by the principle that sex workers can no longer be denied their constitutional right. They can no longer be people who are just beaten up with no recourse to justice, or that they can just be subjected to unlawful arrest. In this, we are guided by the letter as well as the spirit of our Constitution, a Constitution which affirms the rights of all of us and the dignity of all of us without any exception. This plan is an innovative plan. It is a plan that is multi-layered, and it is also hugely comprehensive. At the center of this plan is a peer education program through which 1,000 peer educators will be recruited to provide support and assistance to around 70,000 sex workers over the next 3 years. As we heard, South Africa is one of the first countries in the whole world to take a decision to provide pre-exposure prophylaxis to sex workers. It will also be among those countries pioneering universal test and treatment for sex workers, whereby a person who tests positive for HIV will be offered treatment regardless of the CD4 count that they have. This plan goes beyond the provision of health services. And ladies and gentlemen, it is for this reason that we say the South African government is a caring government. It is for this reason that we say South Africa is a caring country. We are defined by our solidarity and our care for those who are vulnerable. The difficult issues of violence, the difficult issue of stigma, alcohol and drug abuse, depression, social isolation, forced migration, and also lack of economic opportunities are all addressed in this plan. This plan has left no stone unturned. We would like to see all national and provincial departments as well as our municipalities and development partners working together to implement this national plan. Earlier, when I entered here, I saw Andrew, my good comrade and friend Andrew. I met Andrew together with other colleagues earlier last month, and they raised the issue of getting our provinces to up their game in as far as their involvement in the SANAC work, particularly getting premiers of our provinces to be the real champions of fighting against HIV/AIDS and TB. Andrew, I am pleased to inform you that I've just come out of a meeting with the premiers of our country as they were meeting in the presidential working group, and I pass on your message to them that we would like the premiers of our country, the mayors of our district municipalities, the mayors of our local municipalities to be the champions of HIV/AIDS and to be SANAC champions in the places where they work, and they must chair those AIDS councils at provincial, district, and municipality level. So your message has been passed on. And they have committed, Andrew, that they are going to take up their job seriously and become the champions. So I've executed what you asked me to do. This plan is critical because we know that the sex worker community is vulnerable and they're highly mobile. As this plan unfolds, we will need to deal with the legal status of sex work. We will also need to ensure that our laws balance the rights of individuals and the needs of our society as a whole. This should be an opportunity for all of us to get involved in a dialogue that is going to enable us as South Africans to discuss the challenges that we are going to have to grasp with, the challenges of how we deal with the legal status of sex workers, and also how our current laws are going to have to balance the interests of sex workers as well as the needs of society as a whole. As you have heard, this is the work which the government is engaged in. As it is now, the Law Commission has come out with a report, and this is going to kickstart a process of discussion and dialogue. This plan aims to sensitize healthcare providers, social workers, and law enforcement officials on the rights of sex workers to quality care, confidentiality, as well as the issue of consent. Consistent with our commitment to ensure that all South Africans have access to legal representation, SANAC has partnered with the Legal Aid South Africa, that is, to provide legal and paralegal support through a call center service to sex workers who are arrested. Let us today pledge to end discrimination against the vulnerable people in our society and to protect those who are involved in sex work. Let us pledge to end all forms of violence and discrimination against girls and women. Let us pledge to develop sound policies as well as to pass progressive laws that promote the human rights of all of us. This plan sets us on a journey. This is likely to become a difficult journey. It is likely to become a very noisy journey, a very boisterous journey, and it is not going to be an easy journey. There will be practical challenges that will need to be overcome, but we must make sure that we all participate in this journey with a great deal of courage and bravery. There are many complex legal and moral and social issues that we will need to grapple with. As we do so, we would do well to reflect on the wonderful words that were once said by Steve Biko when he said, "We have set out on a quest for true humanity, and somewhere on the distant horizon we can see the glittering prize. Let us march forth with courage, with determination, drawing our strength from our common plight and our brotherhood. May I add, which he didn't add then, our sisterhood. In time we shall be in a position to bestow upon South Africa the greatest gift possible, a more human face." I want to read it again because it's quite a profound quotation. We have set out on a quest for true humanity, and somewhere on the distant horizon we can see the glittering prize. Let us march forth with courage and determination, drawing strength from our common plight and our brotherhood, and I add sisterhood. In time we shall be in a position to bestow upon South Africa the greatest gift possible, a more human face. This plan calls upon us to embark on this journey. It calls upon us to recognize the rights of all of us, but in this case, the rights of sex workers. And I know that it is going to be difficult for many South Africans to embrace this notion of granting full rights to sex workers. It is going to be difficult. People are going to be confused. They are going to be questioning this process. But let me add quickly, the rights of sex workers are deeply embedded and deeply enshrined in our Constitution. They are inalienable rights. They have rights just as you and I have rights. As we embark on this journey, we need to recognize that sex workers in our country are vulnerable. They are vulnerable because they carry a huge disease burden. Almost 70% of them are carrying the HIV virus. And many of them are assaulted and victimized on an ongoing basis. They are stigmatized, and as South Africans, we need to take a stand and a view on this and say, sex workers have rights just as all of us have rights, and they should also be protected. That is what we should be saying. And in time, as we engage in this dialogue, discussing this very difficult matter, as Steve Biko said, we should and will be in a position to bestow upon our fellow citizens, sex workers, the greatest gift possible, a more human face that South Africa must bestow on them. And that is what we should show them. We should show them compassion, we should show them understanding, and we should show them the love that they deserve, because they too are people just like you and me. I want to end by inviting Kowali Buthelezi to come and stand right here next to me. Koli Buthelezi is the leader of Sisonke, the national organization that represents sex workers in our country. I've called her here because as we embark on this journey of bestowing upon sex workers, who are people like all of us, as we bestow upon them our humanity, the face of humanity, as we move in that direction, I want us to bestow upon Koli and her colleagues who are sex workers our national flower and give this to them. So we bestow this upon you just to say we appreciate you, we love you, we embrace you. You are South Africans, just all of us are, and we respect you, and we hope that the laws of our country will also recognize you in time to come. Thank you very much. Thank you.